Hello and welcome back to ER Mentorship Hub, where we dive into the complex world of emergency medicine and its guiding ethical principles. In this episode, we're turning our attention to a crucial concept in medical ethics, non-maleficence. Let's unravel this through an engaging case study and discussion. Let's look at a case example. Emily, a 45-year-old woman, brought into the ER after a car accident. She's in pain and requires immediate treatment. The doctors consider using a powerful, yet potentially addictive, pain medication. Here, the principle of non-maleficence comes into play. In Emily's case, the medical team must consider the potential harm of opioid addiction against the immediate need to relieve her pain. This decision isn't straightforward. It involves careful judgment and the consideration of Emily's current state and medical history. Non-maleficence requires the healthcare professionals to choose an approach that minimizes harm, even if it's not the most effective pain relief option in the short term. But first, let's delve deeper into what we mean by non-maleficence. In medical ethics, the term non-maleficence originates from the Latin phrase primum non nocere, which translates to first, do no harm. This principle is a fundamental doctrine in healthcare, emphasizing the importance of safety and harm avoidance in patient care. It's not merely about refraining from causing harm but also encompasses a proactive approach to prevent harm actively. Non-maleficence goes beyond the obvious instances of harm, such as misdiagnosis or errors in treatment. It encompasses a broader spectrum of medical practice, including the mental and emotional well-being of patients. It involves considering the potential long-term impacts of medical interventions and the subtle ways in which harm can manifest. For instance, a treatment that causes significant side effects may technically treat the disease but could harm the patient's quality of life, thus violating the principle of non-maleficence. This ethical principle requires healthcare professionals to critically assess and weigh the risks and benefits of each treatment option. It's about making informed decisions that minimize the potential for harm even in situations where complete harm avoidance is not possible. For example, in chemotherapy, while the treatment itself is harsh and can have significant side effects, the decision to proceed is taken only when the potential benefits outweigh the risks. Non-maleficence also involves respecting the patient's body and integrity. Unnecessary procedures or interventions that may pose a risk, however minor, must be carefully evaluated against their necessity. In this context, the principle of non-maleficence is closely linked with informed consent, ensuring that patients are fully aware of the potential risks and benefits of any procedure or treatment, thus allowing them to make an informed decision about their care. Additionally, non-maleficence extends to the judicious use of resources. It recognizes that unnecessary tests or treatments can not only harm the individual patient through exposure to potential risks but also harm the broader patient community by diverting resources away from where they are more needed. In the dynamic and often urgent context of emergency medicine, where decisions are made rapidly, non-maleficence is a guiding light, reminding healthcare professionals to pause and consider the implications of their actions. It's a principle that demands not only medical expertise but also ethical sensitivity and a commitment to holistic patient care. In conclusion, non-maleficence is a multifaceted and dynamic principle, integral to medical ethics and patient care. It's about a commitment to safety, harm reduction, and the respectful treatment of each patient. As emergency medicine professionals, our adherence to this principle is crucial in providing the highest standard of care while ensuring the safety and well-being of our patients. Let's delve deeper into the application of non-maleficence with more case studies. Consider Mark, a 30-year-old with a history of drug abuse, who arrives at the ER with a minor injury. Prescribing pain medication standard for such injuries might pose a risk of relapse into addiction. Here, the principle of non-maleficence dictates that the medical team should seek alternative pain management strategies that don't involve addictive substances. Another aspect of non-maleficence is not just about the treatments we provide but also the treatments we choose to withhold. For example, in the case of an elderly patient, George, who is in the final stages of terminal cancer, aggressive treatment might prolong his life but at the cost of significant suffering and reduced quality of life. Here, non-maleficence guides the healthcare team to consider palliative care, focusing on comfort rather than cure, to avoid causing additional harm through burdensome treatments. Let's look at one last case to illustrate the principle even further. Imagine a scenario involving Clara, a 68-year-old woman with advanced dementia, who is brought to the ER following a fall at her nursing home. She has a fractured hip and is clearly in distress. However, due to her dementia, Clara is unable to understand the situation or communicate her needs effectively. The medical team faces a dilemma. Surgery is the standard treatment for a hip fracture, but in Clara's case, the risks associated with anesthesia and the post-operative recovery may be significantly higher due to her age and cognitive condition. This situation calls for the careful application of the principle of non-maleficence. The ER team must consider not only the immediate harm of leaving the fracture untreated but also the potential harm that could arise from the surgery itself. Given Clara's advanced dementia, the risks include postoperative delirium, prolonged hospitalization, and the potential for a significant decline in her overall quality of life. In applying non-maleficence, the healthcare professionals must weigh these risks against the benefits. They need to consider alternative treatment options, such as pain management and non-surgical stabilization, which may be less effective in treating the fracture but could minimize potential harm to Clara. This decision-making process should also involve her family or caregivers, ensuring that they understand the risks and benefits of all available options. Furthermore, the team must consider Clara's overall health trajectory and what is known about her values and preferences. If Clara had previously expressed a desire to avoid invasive treatments or prioritize comfort over life-prolonging measures, this would be crucial information in aligning the treatment plan with her values, thus adhering to the principle of non-maleficence. In this case, non-maleficence is not just about the medical procedure itself but about respecting Clara's dignity and remaining life quality. The ER team's decision should prioritize minimizing harm even if it means deviating from standard treatment protocols. By doing so, they honor the principle of do no harm in a situation where the right course of action is not defined by medical protocols alone but by a compassionate consideration of the patient's overall well-being. In the realm of emergency medicine, where decisions are often made under pressure and with limited information, the principle of non-maleficence becomes even more crucial. It's about making the best possible decision in the moment, always with the intention of minimizing harm. However, it's important to note that non-maleficence often needs to be balanced with other ethical principles, like beneficence, doing good, and justice. Sometimes, doing no harm means not doing enough good, and vice versa. It's a delicate balance that requires wisdom, compassion, and a deep understanding of the patient's needs and context. To conclude, non-maleficence is a fundamental principle in medical ethics, guiding healthcare professionals to avoid causing harm. It's about careful, considered decision-making that prioritizes the well-being and safety of patients even in the fast-paced and often unpredictable world of emergency medicine. Thank you for joining us today at ER Mentorship Hub to explore the vital principle of non-maleficence. We hope this episode has enhanced your understanding of this ethical concept and its importance in medical practice. Remember to like, share, and subscribe for more insights into emergency medicine. Stay knowledgeable, stay ethical. Until next time.